Shashi Buluswar is going to be our speaker for the next 30 minutes. He is Executive Director at LIGHT at Lawrence Berkeley National Lab. He also just told me that he teaches at UC Berkeley as well. And he will be leading a discussion of the 10 most important global health technology breakthroughs required for providing healthcare to the global poor. And so with that, I'm going to turn it over. Thank you.
Thank you. Thank you. And I'll actually start by making you a deal, which is instead of giving you 10, I'll give you 50. And it's not just 50 about health, but 50 breakthroughs required to combat global poverty. And as you know, healthcare and access to quality healthcare is a key problem in global poverty. So let me tell you a little bit about our institute, what this whole thing is about, just to get things started. I work at the Lawrence Berkeley National Lab. The National Lab system, as you may know, here, let me just move this closer. How's that? So the National Lab system was set up by the US government going back to the 30s and 40s. Around the Second World War, there was a big rush to make big things that explode. And so, about 17 labs were set up in different parts of the country. The earliest one of which is at Berkeley. It came out of UC Berkeley. Sometime in the 60s, LBL, Lawrence Berkeley Lab, decided not to focus on weapons issues, but focus on public goods. So it established in 1931. It is one of the largest national labs. In the decades, it has won 13 Nobel Prizes. It's got 3,500 scientists and engineers. And it's primarily funded by the US Department of Energy. It gets a sizable chunk, about $800 million a year. But all of that is for US energy-related issues. And our institute was created 3 years back. It's called LIGTT, LIGHT, Institute for Globally Transformative Technologies at Lawrence Berkeley Lab. Our mission is to take all the R&D that the lab has, all the IP, all the capabilities, and leverage them to address problems related to the global poor. And we'll look at examples of that as the conversation progresses. So let me begin by showing you something that I guarantee you cannot see. But there's a beer in it if you can tell me what I'm holding. All right. Give up? Pardon? It is not a microchip. It is actually a very humble grain of corn. And you may wonder why I'm holding this up. I'm holding this up because this constitutes the single most important food source for billions of people in the world. Probably the only food source for well over 1 billion people. Because in much of sub-Saharan Africa, a lot of people practice farming. They practice subsistence farming, which means they eat what they grow. And they practice monocropping, which means they grow only one thing. And the thing they grow is this. Right? Why do I show you this? Because there isn't enough of this. And because there isn't enough of this, there is rampant hunger, food insecurity, and that, as you can imagine, leads to all sorts of issues with nutrition and hence health. And the other reason I'm showing you this is that addressing this issue, how to have twice as many of these little guys, okay, is such a fundamentally complex problem, such a fundamentally different problem than the way we've thought of it here in the US and other industrialized countries, that a whole new science is required. And that lays the groundwork for the way we were thinking about the kinds of science and technology breakthroughs required to address global poverty. So let's look at where this stuff comes from. Right? Not surprisingly, it comes from cobs. You dig a little deeper, it comes from farms of corn. Now this is where it starts getting really interesting. Right? If you go crawl around there, what you see is soil. Right? So far, so good. Now, what do we do to soil to make it produce this stuff? We add things to it. One of the things we add is fertilizer. So why do we add fertilizer? If you go to the Amazon, trees, large trees, you go to the redwood forest, large trees grow by themselves without the need for fertilizer, right? Without the need for irrigation. Why is it that we need fertilizer? Why is it that we need water? Because in a forest, things grow at their own pace. What we've done with agriculture is we are extracting more from the earth, more from soil, than the soil and than the earth is able to give. And one of the things we have to do is add fertilizer. Specifically, compounds of 3 elements: potassium, phosphorus, nitrogen, NPK. Let us focus on one of those, which is nitrogen, which, as you know, is the most commonly occurring element in the air. Right? And the nitrogen in the air is it's very hard to convert into a compound that's usable. Right? And so, again, going back many decades, a couple of scientists, Haber and Bosch, figured out how to do this thing called nitrogen fixation. Essentially taking nitrogen and converting it into compound so that it becomes this, which can be distributed in soil. Now, the interesting thing about the Haber-Bosch process is virtually 100% of the crops in the world are grown using the Haber-Bosch process. Right? Without it, the world would not be fed. Okay? And again, notwithstanding the movement towards organic food without fertilizers and so on, which is honestly a rounding error on the global scale, every farmer in the world has come to recognize, any farmer in the world who has seen fertilizer, used fertilizer, has come to recognize that food cannot be produced without fertilizer. What's the problem? Why is it that there is food insecurity in Africa, even though this stuff exists? Well, it turns out that fewer than 5% of African farmers use fertilizer. And here's the reason. When Haber and Bosch came up with this process, they won the Nobel Prize in chemistry, right? 2 separate Nobel Prizes. And the Haber-Bosch process itself, it requires a factory that costs several $100 million to build, upwards of $1 billion in some cases, depending on the scale. So as a result of that, guess how many Haber-Bosch fertilizer production factories there are in Africa? Pick a number. Between 0 and 0. Exactly. Right? None. And so this stuff has to be shipped in to Africa. And by the time it even reaches the port, let alone a farmer who is many, many, many miles away from the port city, it already costs a farmer who's earning $2 a day. It costs her 50% more than it costs an American farmer. So they can't afford it. And that is why you have farmers in Africa, who, by the way, the majority of whom are women, essentially waiting for the soil to more or less die. When it stops producing, they move on to the next plot of land. And that has led to deforestation. It has led to food insecurity. So there's this fundamentally intractable problem. And the last time it was solved, 2 people won the Nobel Prize. So is this rocket science? I'd say it's probably harder than rocket science. It needs a fundamentally new science. And the way people have been thinking about it is the following. And by the way, one of the things that happens when you don't put fertilizer and you grow stuff repeatedly, as we do in agriculture, is the nutrients in the soil get depleted. And that process of repeated annual depletion is known as nutrient mining, which is why you grow stuff for a couple of years. That soil is no longer useful. Used to be back in the day that people would do rotation. They'd grow various other types of crops. They'd have their livestock there so that the dung would actually would compost into fertilizers. But with increasing population pressures, with increasing demand for food production, those practices are long gone. So there is a move afoot to solve this problem using a brilliant idea around human waste. I mean, when you think about it from purely science, if you ignore the ick factor for a second, right? There's nothing fundamentally different about human waste from animal waste. Fundamentally, there are some different pathogens that our microbiome carries that cattle don't. But if you can convert cow dung and cattle dung to fertilizer, you can certainly do that with human waste. And so there is this big move to capture human waste and convert it into fertilizer. It's not that different from the composting stuff we do here in California, right? Now, here's why this is difficult. Right? And again, the point being that a new science is required to solve this problem. So let's see how this looks in the country of Kenya, which is one of the areas where a lot of interesting programs in food security are being developed. So in Kenya, this is what passes for a toilet. Right? Virtually 100% of the people do not have access to a toilet attached to a sewer infrastructure, the way we do here. So imagine in a US city, all the stuff gets piped to a sort of waste cleaning facility, and there you can arguably take the human waste and convert it. But if this is where the waste is being deposited, in rivers and canals, out in the open, right, in places not connected to a sewer, in places that are connected to pits, it is impossible, it is impractical to think about collecting this stuff. But let's leave practicality aside for a moment and say, if 100% of the fecal matter and urine, which is actually more rich in nutrients, if 100% of the human waste in the country of Kenya were collected, and with only theoretical losses converted to fertilizer, would that solve food security, insecurity? Would it provide enough fertilizer to double the yield of grains? Turns out that the only thing you get with that theoretical capture level is 25%. So now what do we do? There isn't enough human waste, there isn't enough animal waste, there isn't enough compost. How do you solve this problem? If I knew it, I wouldn't be standing here, I'd be in Stockholm receiving the Nobel Prize. Not smart enough for that. But the kind of science we need to think about may lie in bacteria. So as you probably know, a number of plants have bacteria that do natural nitrogen fixation. Can some of those processes be replicated? Okay? And the point of this, and the reason I'm mentioning this in the health context, is that, as you know, food equals nutrition equals health. And we can build all the medical devices in the world, but if we can't solve this problem, people will be weak. Their exposure, and we'll talk about exposure to pathogens in just a second, but that rate of exposure to infection and the rate of infection to morbidity and mortality will be very, very high. So this is a fundamental problem that needs to be solved. And I don't think we'll actually solve healthcare for the global poor unless we take on a problem like this. Let's look at a couple more. I'll show you one more thing, which is slightly larger. You should be able to guess what this is. I guess a beer for this too. It is a vial of vaccine. And why is this important? Because there isn't a single disease in the world that has been conquered without vaccines. Notwithstanding what you hear in the trashy press, it is so fundamental to our health that we cannot imagine healthcare we can't imagine our children growing up healthy without vaccines. Hell, we probably can't imagine going through a flu season without vaccines, right? And for a number of diseases like polio and so on, vaccines were introduced a few decades back, and they've been phenomenally successful. A number of diseases, polio has been virtually wiped off the face of the planet. One of very few diseases to reach that status. Smallpox is the other one. There's still a few pockets left, but the success has been phenomenal, almost entirely because of the polio vaccine, and major public and private drives to get these vaccines to populations everywhere, whether they're in cities or in remote areas. Right? Now, what's the problem? Well, turns out that, so these things have, the vaccines are what are called live attenuated vaccines. Essentially, they make you just a little sick so that your immune system responds and that your system has a memory of that. So the next time your system comes in contact with that pathogen, you're able to respond. And because they have those, it's a little bit of a bug in it, they have, vaccines are highly temperature sensitive. Most vaccines have to be in a very, very narrow temperature range, 2 degrees to 8 degrees centigrade, from the moment pretty much they're manufactured to the moment they're consumed. Okay? And in the US, as you can imagine, refrigeration is not a problem. But let us put ourselves in the shoes of a healthcare worker or a parent or a child living in a village in Pakistan or Afghanistan or Kenya or India. And this is what passes for a clinic there. This is actually a clinic that was funded with a fair bit of money from USAID. Those beds you see, that's where women give birth. That is a toilet with no running water. It is guaranteed to give you more diseases going in than you had before. And then what you see in the other corner is a little cabinet where they were storing these vaccines. They'd been there for months, right? And to be sure, by the time the kids consume this, they might as well be drinking water. It doesn't do them any harm, but it doesn't help at all, except that the parents think the kids are immunized, the healthcare workers think the kids are immunized, and they may forego some precautions that they would otherwise have taken. Okay? And as a result of this, 1.5 million children die each year of vaccine-preventable diseases, not because the vaccines don't exist. In fact, about 50% of the vaccines in the world are just thrown away because they get too hot, because there is no refrigeration. Now, I'll show you some pictures from a field study we did. Some of the pictures are from the field study. So the way vaccines are delivered today, virtually everywhere in the developing world, in rural areas, is there's a certain point beyond which refrigeration is not possible anymore. Right? So they have these cold boxes. So you see that slab over there, they put that in a freezer. Those slabs go down to minus 25 degrees centigrade. And they put them in those boxes, you see in the other corner, and put the vials of vaccine there, and take them on bicycles and boats far, far away. And in principle, these things can last for a couple of days. The problem is that these go down to minus 25 degrees centigrade. And so while 50% of the vaccines in the world get thrown away because they're too warm, there's actually a detection mechanism to tell when a vaccine is too warm. There's a little sticker that is used pretty much in every vial today that changes color the moment it goes above 8 or 10 degrees centigrade. There is no similar thing for when the vaccine gets too cold. So Lord knows how many more are completely ineffective because they're too cold. So how do you solve this problem? Right? Again, we can build all the devices we want, but children need vaccines. There is a move afoot to make vaccines more thermostable, but vaccines are extraordinarily difficult to. The timeline, it takes over a decade to get them through clinical trials, approvals, and finally in the market through a manufacturing process. So that's one thing that needs to happen, much faster than that timeline. The other thing is refrigeration. Imagine low-cost off-grid refrigeration. We're actually hopefully close to building literally a fridge in a backpack, a small, inexpensive fridge in a backpack. I don't know if we're not there yet, but stuff of that sort would be remarkably valuable in getting this stuff to kids. Similarly, what we've done is looked at health, food security, education, human rights, gender equity, climate change and environmental damage, electricity and water. So 9 topics we methodically went through and said, what are the most important science and technology breakthroughs required to make these solutions available to the poor? I mean, our lives are so dramatically better off now than they were a few decades back. Imagine what you would do without Facebook, right? Joke. But imagine, from the moment we get up, probably even through our sleep, we are protected by so many forms of technology that make us healthy, that improve our ability to earn a living, that improve our ability to send our children to school, that give us legal protections, All of these things are missing for the poor. Right? And so you need a new kind of a technology. It's not simply a matter of taking stuff that's working here, waiting for the cost to go down, and then figuring out how to get there. If you wait for that, some of these things will never happen. Others will take too long. In the meantime, so many children, so many people die. So our challenge is to figure out how to build that new generation of technologies. Or if something is looking like it's quite far, far away into the future, how do we accelerate the time to market? Given that in a lot of these cases, there is very limited commercial interest for market. Ultimately, these things have to be financially sustainable. There's no question about that. But who's going to spend $30 million, $40 million in R&D, let alone in production and all that kind of stuff, when the market is so unpredictable, when the profits are so unpredictable, and even if they are predictable, they're low. This is a highly price elastic market. Margins will be low. You'd have to have massive scale, and scale is very, very hard to achieve in these markets. Okay? Let's look at a couple more examples. Actually, no. So from a methodology point of view, what we did was, this was a 2-year study, and we did everything from sort of, analysis of deep biological analyses of things like mosquitoes, political analyses, we took satellite data, we interviewed lots of people, first-hand data, second-hand data, really dug into the logic of how pathogens flow, and so on and so forth. So the study was released in January. I'm more than happy to figure out a way to make it available to you. And one of the other things we did after identifying the technologies is recognizing that if we build it, they will not necessarily come. We also did an analysis to say, once it's done, once it's ready for the market, how difficult will it be to roll out? Because in many cases, there'll be tremendous dependencies on policy reforms, on infrastructure development, okay, on behavior change, on an innovative business model, on access to finance for the user or for an intermediary, and so on. And so point being that in many cases, even if the technology problem, as hard as it is to solve, just solving the technology won't get us there. We then have to really figure out how to do the deployment. And so these are extraordinarily difficult problems, and just getting the technology right is barely adequate sometimes. A couple of other examples. These are pictures of a slum. One of them is in Nairobi, the Kibera slum, which is sort of well known. The other is a slum, I believe, in Bombay, big city in India. And the reason I show these pictures is that if you think of a disease like TB, so if I were to come sit at your table, I had TB and I sneezed, congratulations, you have TB, or are at least exposed to the pathogen. TB anywhere is TB everywhere. Similarly, pneumonia, diseases caused by indoor air pollution, all of these things are exacerbated because the places where a significant portion of the urban poor live have no ventilation, have no lighting, and large numbers of people are huddled in very, very small spaces. So that dramatically increases the exposure to pathogens. Okay? Now, add to that the fact that there are no private toilets, which leads to the problem we saw earlier of open defecation. And as you probably know, open defecation is one of the biggest root causes for the death of well over 1 million children because of diarrheal diseases. And there are lots of water purifiers out there. There are all sorts of interesting things being done on what some very wealthy people in Seattle call the next generation toilet. We can do all of that, but as long as people continue to live like this, they will continue to be exposed. Now you add to that the fact that they don't have their nutrition, the nutritional condition is not very good. That ratio of exposure to infection is also very high. And then you take out healthcare from the equation, the ratio of infection to morbidity and mortality will also be high. And so this is one of the root causes. How do you get rid of this? How do you, and most of these houses, as you can see from the pictures, are made with found material, mud, sticks, plastic. Those that can afford it have tin, but ventilation simply doesn't exist. Windows are hard because even if there were windows, you can barely squeeze through these things, two people walking next to each other. No room for an ambulance, no room for a taxi. Very, very hard to carry people So we believe that we need a new kind of a material that can, in a context like this, build a two-story structure with ventilation, with LED lighting, ideally with a private toilet. Right? But the material has to be inexpensive, it has to be lightweight, it has to be very durable, so it has structural strength. So that we don't see what we saw in Nepal, which is an earthquake just demolishing thousands and thousands of homes because the homes are structurally not sound. Again, one wouldn't normally think of this as a healthcare technology, but you can see why it is so fundamental to health, and hence healthcare. One more example, and this is much more in the context of human rights and gender equity. I'm from India, and one of the things we see in India nowadays is a tremendous rise in the reported incidents of sexual violence. The sad truth is that the incidence hasn't necessarily increased, it's just being reported. It's always been high, right? Because of the proliferation of mobile phones and social media, the general media, their reach has increased, so we hear more about this horrible stuff. But still, it ends up more often than not being prosecuted. It is not prosecuted because there's social stigma. Women don't report it. Even if they do, because of how the police system works, they're often victimized again. And even if it were to go to court, it ends up being this horrible case of he said, she said. Right? Here in the States, or other industrialized countries, we have recourse. Right? We can actually go to a hospital and have the biological evidence collected for DNA identification, which in many cases, our litigious society and its problems notwithstanding, can lead to prosecution, hopefully accountability, hopefully prevention. Right? Obviously, many leaps over there, but at the very least, one of the things that's required is the ability to collect and preserve evidence for prosecution. Okay? And DNA-based rape kits are available here. They're not used very much. They're not used very well. But even processing the material requires very sophisticated laboratories, which again are not available in these contexts. There's no electricity, let alone the money for sophisticated equipment. So some sort of a point of use mechanism to collect, analyze, digitize, store biological evidence, the DNA part of biological evidence, would be a game changer in this space. Obviously, again, it would have to be admissible in the court of law. A whole lot of other things have to happen. Behavior patterns need to change. Stigma has to be removed. But the technology is the beginning. It is one beginning. So the study goes through and identifies a whole number of these breakthroughs, and not the majority of them, but health is the most interesting, the biggest area. It covers about 50. The document itself is 600 some pages. Health is a third of that, just because there are so many aspects to health, whether it's infectious diseases like malaria, TB, HIV/AIDS, diarrheal diseases. Now we have the emergence of chronic conditions, and so on. But across the board, across all of the areas, some of the breakthroughs we identified were sort of obvious. Right? The vaccine for HIV/AIDS and TB, people are working away on it. These are very, very complicated pathogens, and it has taken a very long time to get there. We're not very close yet. Right? Some other things were surprising. So, for instance, we were surprised that the malaria community is divided on whether or not it makes sense to invest in a malaria vaccine. Not that a malaria vaccine wouldn't be a valuable thing to have. It's just that it's so incredibly complicated to make one that they don't believe it's worth the hundreds of millions of dollars it'll cost. They believe that it's much more effective to scale up existing interventions like bed nets and sprays, to which my very simple question is, if your child or my child here in the States were at risk of contracting malaria and dying of malaria, would we say we don't need a vaccine? A bed net and a spray is enough? I don't think so. right? So I think that conversation has to evolve to say the poor actually deserve the kind of technology that we get. And our challenge is to figure out how to make these affordable and accessible. There are a couple of technologies which are quite controversial. I'll just talk about one of them, which is a biometric ID. This is obviously a long conversation, which I will spare you. But point being, some of these were actually quite controversial. And what we are doing over the course of the next few years is identifying a subset of these, working with research institutions around the world and with companies around the world to figure out how to get them to life. Thank you very much. Yeah, happy to take questions if you have any. Happy to not take questions if you don't have. Yes.
You showed the food increase of 25%
Yep.
in Kenya.
Yep.
Why did you think it was not significant?
It was not significant because if it were achievable with a little bit of the stuff being collected, it would have been great. Right? It's impossible to collect 100% of the human waste. My simple point was that if we need a 2x increase, this is not an adequate solution. Right? It's actually, but converting human waste, encouraging people to use public toilets and using that waste to be converted as fertilizer, as an income stream, is a great way to deal with diarrheal diseases and the sanitation problem. It's just not enough to solve the food security problem.
So is light, if I'm saying it right, is it an idea generator, a document generator? Do you actually do the research to help bring these?
Oh, great question. Great question.
And
Yeah.
what about funding? Because
Yeah.
these could be 600 pages of great ideas could have a big price tag.
So I should say that, so the study got published, it got great reviews on NPR and so on and so forth. I went back home and announced it to my family, and my 8-year-old said, "It's very nice that you've written a report." No, this is actually just tangential to what we do. Our main job is to build technologies, right? And you do it in a way which leverages the science and technology capabilities that our lab has, the rest of the national lab system has, and universities. So we partner with MIT, the UC system, and so on. The reason we wrote this report was when we started this whole thing, we said, gee, what should we build? And truth be told, when we talked to experts, we got pet lists, which were not very well researched. And we didn't want to take on such a daunting undertaking just based on people's opinions. And so we were going to do a 3-4 month back-of-the-envelope internal analysis. And as we started sharing these ideas, a number of people, particularly from USAID, said, look, this could be a valuable body of work. Why don't you share this? And so, foolishly we said yes. So from a 3-month exercise, it became a 2-year exercise. And the question of funding, some of these things require a lot of money, right? And so about 40% of my life right now is actually doing that, right? Because there are enough, so this recognition that you need a new science and you can't wait for technologies from here to eventually drop in cost, that realization is fairly important for a number of funders to get. So my job is to get them on board and not just write the checks, but actually use their convening power to bring others to the table as well. But checks are much appreciated if you've got some.
So I come around the area where you showed the club, right? Not from there, but essentially one of the institutes there. And what we had noticed was even if you get them out of the slum area and give them houses, they rent it out and again come back and continue to stay in the slum. So is there a policy change that, because from the government where you're able to sell it out, your solutions?
Yeah, absolutely right. Absolutely right. It goes back to the point I was making, which is some of these things actually require behavior change. And the way we tend to think about it is, you can make these things attractive. We can make these things desirable to live in, as opposed to looking like Soviet-style blocks, right? And I'm assuming you're talking about India, right? If you think of the government housing, they're not attractive at all. They're not places people would want to live. And it's not surprising that people go back to their communities, right? And so, when we do this, the way we would think about deployment is actually having these things constructible in situ, so that you're not removed from your community. And then you have to absolutely think about the aesthetics and design and so on, because it has to feel like a home. Because even if you walk into one of these things, inside, there is that pride of home just as much as we have. And it is extremely arrogant of us to believe that poor means you can't have pride in the little that you own. Great. Thank you very much.
So Shashi will be here after we're done, actually. So this was our last presentation for the afternoon. So he'll be here for any additional questions. I think the professor in him actually really enjoys the Q&A portion. So I wish we had more time for that. I just want to say a quick thank you to all of our keynoters, our panelists and presenters, as well as our sponsors. We would love for everyone to join us for our networking reception. It'll be held in the Waterfront Ballroom. We'll have drinks, snacks there. We'd love to meet all of you and kind of mingle and do all of that. And then tomorrow, we'd like to see everyone back here. We'll start sharply at 8 o'clock, 8:45 in the morning, not 8 o'clock. Thank you.